Institute, which has been a critical part of excellent healthcare for Albertans for decades. I'm delighted to be here with Health Minister Tyler Shan-Dro to make an important announcement about surgical wait times in Alberta. The MAS is, of course, named after a great Albertan, the Right Honourable Don Mazankowski, former Deputy Prime Minister and Minister of Everything in the federal government. Don's many contributions to public life include having chaired the Advisory Council on Health back in 2002. The report he submitted at that time contained some bold recommendations for strengthening the sustainability of healthcare in Alberta. As Maz said at the time, quotes, "Unless we're prepared to change how we fund and deliver healthcare services, the health system in Alberta will not be sustainable," unquote. Unfortunately, some of his recommendations were not implemented, and we find ourselves facing challenges to the sustainability of our healthcare system. These challenges include unacceptably long wait times for medically necessary surgeries. The median wait time for medically necessary health services in Canada last year for surgeries was 20.9 weeks, the longest among high-income countries. Here in Alberta, the wait was 28 weeks, nearly twice as long as in Ontario and Quebec. Between 2015 and 2019, we saw the wait for open heart surgery in Alberta increase by 23%, by 60% for cataract surgery, by 44% for hip replacement, and 30% for knee replacement surgery. And this doesn't make sense given how much we're spending on healthcare. Alberta has the most expensive healthcare system in Canada, and Canada has one of the most expensive publicly funded systems in the world. Alberta spends over $20 billion a year on healthcare, equal to about 40% of our budget. And as reported in last week's budget, even though we have the youngest population in Canada, our per capita health spending of more than $5,000 a year is about $1,000 higher than in British Columbia, Ontario, and Quebec. Bottom line is, we're paying more, but in too many respects, we're getting less. And that is especially true when it comes to many surgical wait times. These findings echo last year's report by Dr. Janice McKinnon's panel, as well as the comprehensive review of Alberta Health Services recently conducted by Ernst & Young. To quote that report, Albertans can and should get more for their investment in healthcare. In other words, we're paying the most, but we're not always getting the best. Our government was elected on a commitment to maintain or increase health spending and to maintain a universally accessible, publicly funded healthcare system. We also promised to get Albertans their money's worth, including shorter surgical and emergency room wait times through the Surgical Wait Time Guarantee. The AHS review identified cost savings of up to $1.9 billion out of our $20 billion plus system that could be used to achieve better patient outcomes. Now, we've already made some important changes, like cancelling the plan to replace Alberta's existing network of public and private laboratory services with a $600 million super lab that we can't afford now. And we're looking at cost-saving opportunities in other areas, like contracting out on a competitive basis non-medical services like laundry and food, as well as partnering with more chartered surgical facilities that can provide timely, quality care at lower cost. Our focus is on putting the interests of patients at the center of the system. That's reflected in our recent announcements to renovate and expand the overburdened emergency department down at the Peter Lougheed Hospital in Calgary, and to fund an equally overdue upgrade at Red Deer's Hospital. Under the Alberta Surgical Wait Times Initiative that we committed to in the last campaign, we will spend $500 million over the next 3 years to substantively reduce wait times. We will achieve this partly by following the lead of the successful Saskatchewan Surgical Initiative. Launched back in 2010, that program achieved a 75% reduction in surgical wait times in that province over 4 years. And the number of patients waiting more than 6 months for surgery dropped in Saskatchewan by 96%. Now, our university med schools, like here at the U of A, are producing gifted practitioners who will save, extend, and improve countless lives. We have state-of-the-art medical technology and facilities. And by optimizing the deployment of surgeons within our medical infrastructure, we'll achieve shorter wait times that will be competitive with any jurisdiction across North America. To that end, today, I am very happy to announce that Alberta taxpayers will provide capital funding of $100 million to upgrade and renovate public operating rooms and surgical equipment across Alberta. This $100 million surgical capital investment will let our major hospitals perform more complex surgeries every year. And it will free up rural and independent surgical facilities to provide lower-risk surgeries more quickly. Minister Shan-Dro will share the details, but here's the big picture. Thanks to our administrative reforms and this new funding, the total number of surgical procedures done in Alberta this year will increase by an estimated 17,000 surgeries, and by 2023, we expect that annual number to grow to 30,000 more surgeries performed annually. That means, over the next 4 years, we hope to see about 80,000 additional surgeries performed, cutting wait times, getting critical care to Albertans more quickly, instead of forcing people to wait for months and sometimes years as their health condition deteriorates, and too often they become dependent on pain-killing medication. Part of working in a hospital, right?
It is.
So that means that tens of thousands of Albertans facing serious medical problems will get surgery when they need it. Many won't feel the need to leave the country and pay exorbitant fees to get it done outside of Alberta, outside of Canada, as too many have to do now. Albertans want, expect, and deserve the highest quality health care that their hard-earned tax dollars can buy. And that includes medically necessary surgery when and where they need it. So even at a time of significant fiscal and economic challenges, we are funding healthcare at record high levels, the highest levels in Alberta history, the highest per capita levels in Canada. And we are maintaining physician compensation as well at record high levels. The bottom line is this: there is enough money in the health system, and now that money is being spent more effectively and efficiently to ensure Albertans get the timely, top-quality surgical care that their tax dollars are paying for. Thanks very much.
Thank you, Premier Kenney. This is wonderful news for Albertans. AHS is pleased to have the support of our government to meet the surgical needs of our patients in both rural and urban centres. I would now like to introduce Alberta's Minister of Health, the Honourable Tyler Shan-Dro.
Thank you, Kathy. Thank you. Well, thank you, Kathy, and thank you to all of you for joining us here today. As Premier Kenney said, today's announcement is great news for all Albertans, folks in larger cities and rural communities alike. Thanks to this investment, Albertans are going to get quicker access to the surgeries that they need closer to home by upgrading facilities in larger centres and moving some lower-risk surgeries, as Premier said, to smaller centres. This $100 million investment will help hospitals across the province provide thousands more surgeries to Albertans every year. I'm going to walk us through some of the preliminary concepts so you can appreciate just how logistical the rollout is going to be. To take Calgary, for example, the Foothills Medical Centre will see upgrades in up to 12 operating rooms. Meanwhile, low-risk surgeries will be moved out of the Foothills and offered in neighbouring Canmore and High River, as well as the independent surgical facilities in Calgary, relieving pressures on the city's hospitals with long waiting lists. In central Alberta, renovations at the Rocky Mountain House Health Centre will help staff there perform more endoscopy procedures, and that in turn will take off pressure from the Red Deer Hospital so that staff there can focus on more complex surgeries. Low-risk surgeries will also be moved out of the Red Deer Hospital to Innisfail, to Stettler, to Ponoka, and as well to Olds. And here in Edmonton, there will be renovations to the operating departments at the Royal Alex and as well here at the University Hospital, including the addition of one new operating room. And to take pressure off of those facilities, lower-risk surgeries will be moved to the Fort Saskatchewan Health Centre, the Grey Nuns Community Hospital, and as well the Sturgeon Community Hospital in St. Albert. Now, looking south to Lethbridge at the Chinook Regional Hospital, 2 smaller operating rooms there are going to be combined to be able to have one larger space for more complex surgeries. And the Medicine Hat Regional Hospital will also see renovations there as well. More surgeries will be possible further north as well, as Grand Prairie will be fitted with an operating room, and the Edson Healthcare Centre will convert space into a second operating room. All of these efforts will help us to reach our goals to provide 17,000 more surgeries across Alberta by the end of this next fiscal year, and 80,000 new surgeries in the next 3 years. Yes, these are ambitious goals, but they're also realistic goals, thanks to our surgical capital investment plan. And that's why I got involved into politics. And I know Premier Kenney feels the same way, to make a real boots-on-the-ground difference in the lives of everyday Albertans. The bottom line is this: Albertans who need surgery are going to get it sooner, and they're going to get it closer to home. And if you're one of those people, or someone who cares for them, nothing is more important than that. So thank you, Kathy. Thank you, Dr. Yu, for having me here today. And thank you for listening and coming today. Thank you, Kathy.
Thank you, Minister. I would now like to introduce Dr. Verna Yu, President and CEO of Alberta Health Services.
Good morning to everyone, and it's a pleasure to be here on behalf of Alberta Health Services to share the news about further efforts to improve patient care and drive down wait times. Today's announcement of a $100 million upgrade to operating rooms across the province will ultimately lead to more timely access for many Albertans who need surgical care. It will also mean more Albertans will be able to undergo surgeries in their own communities, enabling these patients to be closer to their families, friends, and other support systems as they begin their road to recovery. I'm very proud of our healthcare system and the work for all our healthcare providers that they do each and every day over the past decade. And together, I think we've made some significant advances over the past 10 years. But yet we know that we need to address the issue of wait times. Managing wait times is a complex problem, not just here in Alberta, but right across Canada. And there are many factors involved. Our growing and aging population increases the demand for surgery, as you might expect. And technological advances also increase the demand because surgery can now be used to treat more health conditions than ever before. Keeping up with that increased demand has been a challenge, and today's announcement is part of the solution. Not just the $100 million, but the strategy which aims to ensure that Albertans are able to receive safe, timely surgical procedures in the most appropriate settings. We want to bring down surgical wait times. We know that waiting for life-enhancing procedures can take a toll on patients and families. And so we're very grateful to Premier Kenney, the Government of Alberta, to Minister Shan-Dro and the Ministry of Health for their ongoing commitment to help AHS provide timely, high-quality care for patients and families. Thank you very much.
Thank you.
Thank you. Thanks, Premier.
Thank you to Premier Kenney, Minister Shan-Dro, and Dr. Verna Yu. And thank you to all of you for joining us here today. I'd like to invite our speakers to gather for a photo, and there will be an opportunity for questions following the photo.
We'll go ahead with the questions, I think. I think you guys have got enough pictures, right? We're good.
Go ahead, Dean.
Okay. Morning. Question for Minister Shan-Dro and one for Dr. Yu, if I may. Minister, a two-part one. The EY report said that we're not actually utilizing the existing operating space. I think it's like 70 to 90, right? So, but yet we're putting 100 million in to, create more operating space. It looks like this report is going to address utilizing the existing space. Is that right? And if so, by how much?
Oh, it is. So, and a big part of this is making sure that the more complex procedures are going to be done in the major urbans, while the lower risk procedures can be done in a facility, especially the ones that are near a major urban, those smaller communities, or the ones that are along the Highway 2 corridor between Edmonton and Calgary. But the second question was what was you
I
asked?
just wanted to reconcile if we're solving the underutilization problem with this announcement.
Yeah, this is part of it's not necessarily with this announcement, but with the Alberta Surgical Initiative, we are solving that issue in general. This is part of the Alberta Surgical Initiative. We understand that we do have to add 80,000 new surgeries over the next 3 years. But for us to be able to do that, we know that we need to make this investment in our public operating rooms to be able to make sure that there's the capacity there for us to meet those needs. So this is part of the Alberta Surgical Initiative.
Okay. Dr. Yu, can I ask you a question? A lot of stories swirling around, doctors saying they're going to leave, they're not going to leave. My understanding is before they do so, they'd have to notify AHS. So who better than you to clarify for Albertans what's happening with Alberta doctors? Are they telling you, are they giving you notice that they're leaving? Are you seeing rates higher than the normal turnover for doctors?
Right. So I just want to state, first of all, that Alberta physicians, not all Alberta physicians actually have appointments with Alberta Health Services, so I cannot speak on behalf of all Albertan physicians. Alberta physicians who actually do have privileges within AHS facilities, there is a process as defined by the medical staff bylaws, which requires that any change in the service that they currently provide requires advance notification and a timeline by which we can work with them to make sure that patient care is continued. So.
Yeah, so, but of the ones that you oversee then, I think Albertans would like to know, are they telling you they're leaving?
We have
seeing an uptick?
We have not seen any official requests for physicians leaving up to this point. We have not had any formal requests. So.
Do you have any concerns that, do you have contingency plans in place in case they do?
Sure. So I'm a physician myself. I'm a practicing pediatric nephrologist. And I came back to Alberta 25 years ago at a time when every physician was actually probably leaving the province. I believe that Alberta is one of the best places to practice medicine in Canada, and I love our province. And I would hope that all physicians feel similar or the same. And so I believe that there are lots of advantages to being in healthcare in Alberta, and I would hope that everybody wants to stay.
You managed to squeeze about 8 questions there. That was well done.
This is a question for Minister Shan-Dro. I have 2 questions. First of all, is there any consideration for a provincial wait list under this surgical initiative?
So part of the initiative does include centralizing the wait list in the province. So that's definitely one of the things we're taking from Saskatchewan's lead. Saskatchewan had done a lot of work to centralize their wait list, so that is going to be part of the learnings that we're taking from Saskatchewan. We're not going to go to the extent where we're going to roster patients, but we're going to at least centralize the wait list so we know who the physicians are, we know who the patients are. We can provide some disclosure as well to patients. They'll know where they and other specialists might have with their weights, and so patients can make those decisions about which specialist they want to be able to provide that surgery.
You used a term I'm not familiar with. You said roster those patients. What does that mean?
So that is if a government or a plan ends up forcing a patient to go to a certain physician to have that procedure done with that physician, we're still going to allow patients to decide who their physicians are going to be, but we will still at least be centralizing the wait list.
Okay. And my second question is, you talked yesterday in question period about using replacement doctors. Where would these doctors come from if it came to that point?
So, Verna, do you mind if that's actually a question for Dr. Yu?
Okay. So one of the things that we do is that we do actually have a locum program. So this is not unique in terms of the fact that there may be certain circumstances, especially in rural Alberta, where we may find, for example, for a certain weekend that the emergency room may not be covered if somebody got sick or somebody had to be called away. And so we actually use a locum program that we partner with Alberta Medical Association, and physicians actually can work as locums to be in certain settings for certain periods. So I think that was what the minister was alluding to around so-called replacement. We tend to use the word locum.
And these would be Alberta doctors already
Yeah,
practicing
they're
in Alberta?
Alberta doctors that are practicing, and some physicians like to work in a locum model. So, yeah.
Got a question for Premier. Off topic today from today's announcement, but I wanted to bring up the fact that the NDP is going to be bringing forward an amendment later this afternoon to defund the war room. And I take your point that you've made that they've been against this since day one. But I'm wondering if you're prepared today to give a precise measure of success for the $30 million a year that's going into this thing? I mean, what are the precise things you're looking for
Sure.
To justify that payment?
So first of all, the creation of the Canadian Energy Centre was a platform commitment we gave to Albertans that I think was hugely popular, because Albertans understand that we've got to stand up and fight for a future for our energy workers and our prosperity against the foreign-funded campaign to landlock Alberta energy. And so this is bringing together all of the previous advocacy efforts, including advertising, and adding to them. The Energy Centre has only been operating for about 3 months, early days. I think they've pretty much gotten staffed up. Today, I understand, just now, they've released their first major research report, Canada's Oil Sands and Local First Nations, a snapshot which will be part of an ongoing body of research that underscores the social benefits of the Energy Centre. I would hope to see more research like this. I think the big impact will be when the Energy Centre begins launching their major advertising campaigns. I believe they intend to do one to support, to explain the benefits to all Canadians of the Trans Mountain Pipeline expansion, particularly focused on British Columbians. I believe they'll be doing a campaign to explain the economic and environmental benefits of liquefied natural gas exports, and another campaign just to improve energy literacy all across the country, as well as targeted efforts to communicate with European financial markets about the shrinking environmental footprint of the Canadian oil sands. So these are all major projects that they're working on. The vast majority, probably over 80% of the budget, will be invested in advertising to tell Alberta's great story about prosperity, energy, and the environment across Canada and around the world. The previous NDP government prided itself on having spent, I think, in the range of $10 million a year or more on pro-energy advertising campaigns. That's exactly what the CEC will be doing. It'll be a little bit bigger and more integrated.
Sorry, was the research you just cited there, have you had a chance to review that yet?
No, just hot off the presses.
Do you know, like, how much money's going into research at the Canadian Energy Centre?
You'd have to ask the centre. I'm not familiar with the details of their budget allocation, but I do know they have a director of research who has a PhD and a small research team that will be helping to bring together the positive news about Indigenous participation, labor rights, environmental progress, shared prosperity, all of those facts that support an argument for a vibrant Canadian energy sector.
On the surgical initiative, we're adding more surgical facilities, we're farming more out. Are we hiring more surgeons? Are we busing surgeons around? How does this work where we're actually doing 17,000 more surgeries as far as staffing is concerned?
So I think I'll speak about staffing in general, not necessarily the physicians. Maybe I'll let Dr. Yu maybe answer that question. But I think there's going to be a need for modest increases for these operating rooms, and especially in the major urbans. As my understanding is that's going to be part of the increased. I think Premier mentioned there was over $500 million that's going to be over the next 3 years to be able to meet this guarantee. And so that's going to be part of it. There will be modest staffing increases as well in these units. And then as well for the physicians, maybe I'll let Dr. Yu maybe speak to that issue.
So yes, there is going to be a need for increase, and it's not just physicians, there's going to be other allied health professionals. And so part of the Alberta Surgical Initiative is actually a workforce plan that talks about the specifics in terms of the numbers of people that we're going to need to deploy and hire.
So then I guess that leads to freezing physician salaries at the $5.4 billion. If we need to hire more physicians, more surgeons, if we're sending them out to private facilities, where does that budget line come from? How does this work on the compensation goal of the province if we need to add surgeons, but you don't want to add salary?
So a lot to unpack there, though. They aren't salaried, and these aren't private facilities. These are taxpayer-funded facilities, these chartered surgical facilities, right? So they're not private. They may be independently operated and owned, but this is taxpayer dollars going to spend. So just to clarify that for you. But we are spending $5.4 billion, again. As I've said many times, this is the highest in the history of this province. It is, we're not freezing salaries because they're not salaried. Most of these surgeries are going to be done. Actually, that's not true. We have about 61. We call these alternative relationship plans. They're contract plans where physicians are paid on a contract basis. So we have 61 of them right now, I think, in the province. We've had applications for 88 more since we've announced the new physician funding framework. So 88 more are in process to be approved. Some of them are for specialists for the surgeries, like I think cardiology in Calgary, for example, is on this ARP model. But our goal with the new physician framework it was always to just make sure that the cost overruns of $2 billion over the next 3 years that we were projecting, that those forecasts are going to be addressed. And so we're not freezing anything. We are going to continue to ensure that we're making, that the physicians here in Alberta are going to continue to be among the highest paid in the country.
We're going to go to the phone. Operator, can you put through the first caller, please?
First question comes from James Keller of the Globe and Mail. Your line is open.
Hi, a question for the Premier. Last week, the Justice Minister's letter to the federal government on the carbon tax decision suggested there could be more legal action coming. Last night on your Facebook Live Q&A, you said there'd be an application coming soon. So does that mean that you've decided on your next course of action? And can you explain what exactly that's going to entail?
Well, Cabinet has not had a chance to review that yet. Minister Schweitzer's letter is very clear. We call upon the federal government to respect the carbon tax decision of the Alberta Appeal Court, which clearly asserted provincial jurisdiction over this area. And we'll let you know if there's news to follow on any further actions.
Do you have a follow-up, James?
And what would be the point of, what would be the point of launching new legal action, given the potential cost and when we've got a Supreme Court of Canada hearing in just a few weeks?
We'll be considering all of that, but even if there is a hearing in a few weeks, a decision would not be rendered probably for several months towards the end of the year. And the point is, we told the federal government that they were operating outside of their jurisdiction. They didn't listen. They proceeded. Instead of trying to work with us on an approach, they decided to impose a tax that punishes Albertans for heating their homes and driving to work, and we fundamentally disagree with that.
Operator, can you please put through the next caller?
Our next question comes from Claire Theobald. Your line is open.
Hi, this is a message or a question for Minister Shan-Dro. Health Canada's Learning from SARS report identified family care physicians as the sentinels in a potential pandemic outbreak. Minister Shan-Dro, what do you say to those who are concerned that these fee changes and cuts, potentially driving family physicians out of smaller Alberta municipalities, could weaken the province's overall ability to detect and respond to a pandemic situation such as the coronavirus outbreak?
I would say that there are no cuts, that we are going to continue to ensure that. And look, I'd also say this, that we actually campaigned. If you look at our campaign platform, we campaigned on supporting the patient medical home model. And the McKinnon panel as well suggests us to continue to support that patient medical home model, to make sure that family medicine is practiced in a team-based setting, but that's going to be done through these contract plans. The physician contract plans for them to be able to get predictable, stable funding so that they can spend more time serving the patients and less time worrying about how many 03.03As that they charge that day. And so that's our goal, is to make sure that we're supporting the patient medical home model, that we're continuing to support those family clinics and the family physicians who are serving those patients through these physician contract plans and not through a fee-for-service model.
Operator, can you please put through the next caller?
I wanted to supplement that. Again, I just want to reinforce what the minister said. There are no healthcare cuts. The healthcare budget that was tabled in the legislature last week that will be voted on, that's real money. This is not make-believe. It's not spin. These are real hard dollars being authorized by the legislature, actually sees a modest increase in the Alberta healthcare budget. At over $20 billion, a record high, higher than under the previous government, higher than under any government in Alberta history, the highest per capita health expenditure in Canada, about $1,000 higher per patient than Ontario, Quebec, or British Columbia, and physician compensation that is also being kept at the highest level in Alberta history, at $5.4 billion, even after a 289% increase in Alberta physician compensation since 2002. So a tripling in physician compensation in less than 2 decades, growing at about 3 times faster than inflation, population growth, or the growth of the economy, with the highest paid physicians in Canada. Physicians whose gross billings average about $94,000 more per year in Alberta than their counterparts in Ontario, and in a province that, by the way, taxes those high-income earning physicians lower than any other province, and that has a lower cost of living. So we value our fantastic medical professionals in this province. They deserve to be paid not just fairly, but to be paid generously, and that's what we will continue to do. There is no logical financial reason why why a physician would leave Alberta to go to a to receive less remuneration in another province and pay higher taxes on that income, and at least in the cases of British Columbia and Ontario, pay a higher cost of living. Yesterday, Cabinet received a briefing from Minister Shan-Dro and our Chief Medical Officer on the preparation for any prospective coronavirus event in Alberta. Thankfully, so far, we have not had a single positive test on that, but I'm confident that our entire health system, as well as the Alberta Emergency Management Agency, are extremely well prepared for any prospective coronavirus infections in this province, to focusing initially on containment with very robust plans for mitigation should we see that virus spread to our province.
Operator, can you please put through the next caller?
The next question comes from Carrie of the Globe and Mail. Your line is open.
Hi, thanks for taking my question. This affects teaching hospitals. I'm wondering how this will affect teaching up-and-coming surgeons when they're looking at doing low-risk surgery. What happens?
So this is Berna Yu here answering. I'm not quite sure what your question is alluding to, but as you know, all training programs are accredited through the Royal College of Physicians and Surgeons of Canada. So every single training program has to comply through what we call CANMED's competencies, and they all get regular accreditations through regular cycles every 5 to 7 years. So I don't see that any of this should have any impact on training of any physicians.
Do you have a follow-up, Carrie?
Oh, sorry. Yeah, sorry. I just want to word that better then, and then I do have another question. I meant where something like Foothills, where you have doctors who are training under more senior doctors. If they're not doing low-risk surgeries, where do we? What happens to them? Do they have to go to these other small towns for that type of practice?
Sure. Right. So right now there is always going to be a balance between low-risk surgeries and high-risk surgeries, even at Foothills. So the intention is never to completely get rid of all the low-risk procedures and to really maximize use of operating room time. You actually want to have a blend of both. So we'll never completely shift all low-risk procedures. But after saying that, we do have partnerships with the chartered surgical facilities, and there is some surgical training that happens in those facilities because, as I said, training program accreditation requires that you have access and training on all different types of programs. Thank you. Sorry.
All right, we'll come back to the room. Go ahead.
I want to talk about a letter that I assume that you've seen. You were carbon copied on it, that comes from about 580 physicians in the province who say that the changes to fees is going to cause damaging ripple effects throughout the system. They also mention that it's essentially going to make wait times in emergency departments longer as a result. So how do you respond to that claim, I guess, and that your policies are actually making the wait time situation worse?
So I actually don't know the specific letter that you're talking about. I do know that there has been a lot of misunderstanding among our health professionals in the province about what was changed. So I think there was a lot of misunderstanding that I think and I look forward to the Alberta Medical Association helping us clarify the misunderstanding. So if this is about saying to physicians who don't have any overhead, that there are codes, then to pay a different rate for those who don't have any overhead. That's because we shouldn't be paying for overhead twice. I think it was misunderstood that this doesn't apply to a physician who does have their own overhead. They have their own clinic, especially in rural Alberta. They may be a general practitioner, a family physician, and they come in to an emergency room to do, and they could do up to, sometimes 50% of their billings are going to be in that hospital. But they have their own clinic. They don't have to pay. They don't have to be charging a different code. That's a misunderstanding of what has happened. And I look forward to being able to continue to have those conversations with those rural and emergency physicians to be able to explain them the misunderstanding. So if it's about that, but I would also say again, as Premier said, we are going to ensure that we are continuing to pay our physicians in this province so that they are among the highest paid in this country. And so any feedback, though, that any physician has for me about specific changes, I think most of it has been about the complex modifier at minute 15. I think there's also been a misunderstanding we've changed all the complex modifiers. We haven't. We've only changed the complex modifier at minute 15. We've left all the remainder complex modifiers. So there's a lot of misunderstanding, and I look forward to being able to engage with the Alberta Medical Association as well as their members to be able to clarify a lot of the misunderstandings that are out there. Do you have a specific part of that question?
Not a follow-up.
No, sorry, I know about the letter because I don't know that letter. Was there some kind of a conclusion or? Okay.
Yeah. Yeah, your carbon copied at the bottom. It was sent to a couple of MLAs and media outlets.
Did they have a certain code or a certain issue that they thought that we had changed that they allowed them to come to that conclusion?
They didn't mention a specific code, but they speak in general about the fact that they think that the changes are going to lead to a 1994 revisited. They're not embracing these changes.
If clinics close or reduce their hours, therefore the patients have to go somewhere, they go to the emergency
ER.
The waiting rooms back up. That was the kind of thrust of it.
But we again, I mean, this is why, and maybe because maybe it's a little bit too complicated that folks aren't catching on to this. But we campaign on a patient medical home model. So we have that in Alberta right now. This is where we support those clinics and those physicians to be able to provide team-based medicine so they have the predictable and stable funding. That's actually where we want to go. And we actually want to provide that stable, predictable funding. And part of it is to be able to offer to physicians who are interested the physician contract plans rather than fee-for-service, so that they have that stable and predictable funding. We actually want to keep those patients in those clinics, not in our emergency rooms, and I'm happy to continue to make sure those physicians are understanding that that's what we're actually trying to do, and to make sure again that our physicians in this province are going to continue to be among the highest paid in this country.
We have to get going. Yeah, we have to wrap it up. So one more.
Maybe one more specific question about the procedures we're talking about. When you say low-risk procedure, what is it exactly? And if I'm a patient, say in Red Deer, how is it going to work for me? Will I get a list of spots I could get, say in High River or Ponoka? Or
so this isn't about the patient. These choices are going to be provided by the physician. So right. So it's not a patient deciding whether they're going to be going to Innisfail or Red Deer. This is going to be about what's available to the physicians for them to be able to make the decisions about where the right facility is for the right procedure. We're not going to have the patients make.
So if I'm a patient in Red Deer, what happens?
Well, Doctor, you might.
So if you're a patient in Red Deer and you're needing to have cataract surgery, then it's pretty well known that cataracts are being done in Innisfail. So the surgical team goes out to Innisfail, the patient goes out to Innisfail. All the information that's provided to the patient about that is, about where they need to go, and the patient then goes to that facility.
Nothing changes there?
Yeah, there's really no changes. Yeah.
Thanks very much, everyone.
Thank you.
Cheers.